Welcome back, everyone. The state of Georgia ranks among the highest for women dying while pregnant or after delivering their baby. It's part of a national problem, killing hundreds of women each year. News Channel 6's Renetta Dubose joins us live in the newsroom tonight with what's contributing to maternal mortality and what Augusta University Medical Center is doing in response.
Jenny, 2 women die each day. That's 700 each year. And there are a lot of factors: age or health before pregnancy and access to care. It's becoming such a big problem that medical staff is placing this sheet in the hands of each woman postpartum in order to save her life.
At the time of giving birth, you're in a lot of pain and you just want to get that pain over with.
At the age of 24, Brashonda Wade is preparing for her 3rd child, and she's having a C-section. But little does she know it is one of the contributing factors doctors believe leads to maternal mortality.
I'm more nervous that I'm going to be having this baby sooner than expected, but not so much as my concern of my life.
The most dangerous time in the pregnancy is in the hours and days immediately after delivery.
Augusta University Medical Center's OB and gynecology specialist, Dr. Chadburn Ray, says he's seen an increase in the past decade in women dying while pregnant or within a year after giving birth.
There's 3 problems, right? The patient, the provider, the system.
He says women are having more issues due to not being healthy prior to getting pregnant, such as having high blood pressure. Factors such as being older than 35, African American, or being overweight contributes too.
We're seeing more women die from cardiovascular disease and cardiovascular related death. We're seeing more women have peripartum cardiomyopathies, which specifically in the state of Georgia is a significant cause of maternal mortality. We're seeing more deaths due to hemorrhage.
He says insurance companies are paying for shorter stays after labor too, but it is vital that the patient also comes back for her 6-week checkup. But distance can prevent that before and after the baby arrives.
That as we see more hospitals close and we can actually capture the data, that we're going to likely see that the distance from the hospital will also make a difference as to one's risk for a complication related to pregnancy.
Dr. Ray wants to place a toolkit like this one in the hands of every OB doctor in the state of Georgia. It's a book that explains how to prevent maternal death and the signs that often go unnoticed by the patient and the doctor. Brad?